Review.
Defining Remote by Scott Smith and Brian Harper. Exotic, far-flung destinations hold pristine sites full of natural beauty. But the more remote the location, the more difficult it may be to manage an emergency should one occur. Understanding the specific challenges presented by remote environments gives adventurers a leg up. These challenges include time, environment, resources, and independent decision-making. Firstly, time. In cities, towns, and many resort areas, people are rarely required to spend more than a few minutes with individuals who are seriously injured. Emergency medical technicians, paramedics, nurses, or doctors are available to take over care within minutes. In the time it takes to place a call and have an ambulance, the patient can be in the hands of expert care providers. In remote environments, however, traveling companions may find themselves forced to give care to the best of their ability for hours or even days. This means wounds must be cleaned thoroughly to prevent infection, and splints, wraps, and slings may need to be constructed to limit further injury to bone and muscle. Medication may have to be administered, and careful notes should be taken to give to professional caregivers when an evacuation can be conducted. When providing care over an extended periods of time, there is more than just the patient's medical needs. Caregivers must also figure out how to help them stay nourished, hydrated, warm, and able to relieve themselves. It isn't just training, planning, and sound judgment that are helpful in extended care situations. Good bedside manner and a willingness to provide comfort and encouragement are important as well. Environment. Hospitals, clinics, and even ambulances offer climate control, shelter, light, and other amenities that are not guaranteed in wilderness settings. Be prepared to care for injured traveling companions in darkness, rain, and high winds when you visit remote areas. Be ready to face the sun's relentless rays, lethargy-inducing heat, and finger-numbing cold as you administer aid. Since bad conditions can increase the potential for injury, it is quite possible you'll be called on to provide care in heavy weather, at night, or in extreme temperatures. Evacuation to a higher level of medical care will not be necessary for every little annoyance, but be prepared for trips to the doctor, simple infections, and other seemingly mundane problems to become a day-long ordeal. Resources. When an ambulance arrives at the scene of an accident, it comes loaded with equipment designed to provide assistance and relief to the sick and hurt. When no ambulance is available, you're stuck with the gear abroad, on your boat, or in your backpack. This means time spent deciding on what to take is time well spent. It's worth brainstorming a variety of scenarios to improve the chances of being prepared for the most likely and most serious situations you may face. It also means you may need to improvise important gear that you don't have with you. Effective improvisation of equipment is an essential skill in wilderness medicine. Even where medical care is available in rural or remote areas, the imaging equipment necessary to determine injury may not exist. Basic casting materials, medications, and expertise in reducing fractures, for example, may likewise be unavailable. It might be necessary for a group to splint an injury using whatever padding and rigid materials are available. When doing so, immobilize the injury without restricting circulation, and always use padding. Lots of it. Group members may even need to build a makeshift stretcher that can be dragged along the ground or carried to transport a patient to a clinic, hospital, or airstrip. This is appropriate except when a patient may have suffered a spine injury. When a spine injury cannot be ruled out, avoid moving an injured person unless there is an immediate threat to life or group members have training to deal with the patient using a backboard. that is, a device designed specifically for moving people with injured spines. Some equipment should not be improvised. Independent decision making. When a satellite phone isn't available and you cannot get a cell signal, you may find yourself having to make decisions without the guidance of a doctor, Dan Medic, or other expert. Good judgment in decision making comes with training and experience. And if you don't have these, travel with those who do. Ask your guides or tour operators about their training and emergency protocols before you book your trip. Some small island resorts have clinics in which physicians or nurses rotate through, but even in these cases, the simplest diagnostic test may not be available, and you may be faced with making significant decisions with less information than you'd like to have. When you're able to reach Dan, a doctor or local emergency service for consultation and evacuation, be ready to answer the questions they ask. From the moment an accident occurs or symptoms of an illness first appear, designate a member of your group to keep notes on the evolving situation. Preparation. Pack a headlamp and spare batteries in your first aid kit so you are prepared to help a traveling companion at night. Extra water, sunscreen, and insect repellent will be appreciated by all in the group if they are forced to move in an exposed area because of acute injury or illness. Although space and weight are often at a premium when traveling off the beaten track, a spare insulating layer is invaluable if someone gets hurt. When in doubt about items like rain jackets or wide-brimmed hats, bring them rather. Good exposure protection will help maximize the number of able-bodied caregivers while minimizing the number of individuals who need help. Pack a notebook and pen to make sure you can keep a record. A log of the patient's condition over time may be very valuable to medical professionals who have to take over patient care later. Before you travel to a remote area, determine whether any immunizations are recommended for the area and schedule those accordingly. Research the locations of nearest clinics and hospitals. Find out the emergency number for the local embassy or consulate in the area you're traveling to. Remember to consult the websites of the Centers for Disease Control and Prevention, the World Health Organization, or the US State Department. And in the case of Dan membership, they can visit World Q Planner on www.dan.org as a free membership benefit. Some travelers' primary care physicians or dedicated travel clinics can provide precautionary antibiotics to treat simple infections should these occur. Dan does not specifically support or discourage this. It's a decision made by the traveler and their physician. If you do take any medication regularly, ask your physician about prescribing a backup supply that you can keep in a separate place in case something happens to your medication and it's not available at your destination. Consider getting training in wilderness first aid. With training, your preparation, decisions, and judgment will improve. Since most people travel with their friends or family members, the well-being of your traveling companions may be a powerful motivator for seeking such training.